Hi everyone, welcome to our Instagram live. So we're gonna wait for everyone to join in. So today we'll be talking about over-the-counter pain medications that's available in Malaysia, and I'll be joined by by Miss Daphne Chen, and she is joining soon. So we're just gonna wait for everyone. Hi, Miss Daphne.
Hi, Dr.
Hi. I'm Sanjiv here. So thank you for joining us today.
Thanks for having me here.
Yeah, can you hear me?
Yeah.
Okay, that's excellent.
Can you hear me?
So we're just going to wait for five minutes to let everyone log in, and then we'll start.
Yes.
Yeah.
Okay, sure.
One second. One second. Okay. So welcome everyone. Welcome Olivia, Emilia, Buntak, Lucas. Thanks for joining us today. We're just going to wait another 2 more minutes and then we'll start. Yeah.
Okay, sure.
Okay, so we'll wait for another 2 minutes. So while we wait, I'll give you a little background about what we do, Miss Daphne. So this is the Rampalsurgery Instagram live series, where we talk about healthcare related and mainly pain related matters. I'm a practicing orthopedic consultant, and I deal mainly with joints and all orthopedic related matters. Yeah. So welcome everyone. Welcome Kiran, Amy, and Kimberly. Nice having all of y'all on here, and it's great to. We're just gonna wait for 1 more minute to let everyone start, and then we're gonna start on. Yeah. Yeah. Hi, Jesse. So a little background: Miss Daphne Chen is a practicing pharmacist, and she deals with pharmaceutical side on a daily basis, and she has numerous experiences locally and internationally. And we'll be talking to her today. We'll be talking a little bit about. We wanted to get her opinion also regarding over-the-counter medications. Yeah, we're going to start in basically 30 seconds. Okay. All right, we're going to start then. Yeah, Ms. Daphne. So we're going to start. Yeah, hi everyone. Welcome again on a beautiful evening in Kuala Lumpur. And thank you for joining in on Rampalsurgery Instagram live session. Here on the Instagram live sessions, we usually have medical healthcare workers, and we talk numerous agendas, especially dealing with pain and musculoskeletal pain and diseases, especially dealing with joints and muscles and bones. Yeah. So today we have the great honor of being joined by a clinical pharmacist, a practicing pharmacist, who she'll be helping us go through a little bit about over the counter medications that's available. Yeah. So with Ms. Daphne, thank you so much for joining us. Would you like to tell us a little bit about yourself, and then I will start with my intro. Yeah.
Yeah, sure. Thanks, Dr. Sanjiv, for having me here today on his platform, Rampalsurgery. And hello, everyone. I'm Daphne, and I'm a registered pharmacist working in a hospital. Okay.
Yeah, that's
So today we'll be discussing about over-the-counter pain relief options.
yeah, that'd be great. So, guys, as you all know, there's different types of pain, and pain is a real, and it's also considered as the fifth vital sign. Vital signs may be the blood pressure, heart rate, and also other matters, temperature, and so on. We consider pain a key element in dealing with when we deal with our patients. Pain can be different types. It can be either short duration, long duration. It can be mild. It can be moderate. And it can be severe. So I thought this session would be a nice session for us to address when you have mild pain, or let's just say you have the common fall, right? As we all know, there's the common pains that occur in our practice is usually ankle injuries, or a fall, a minor fall, or you slip, or you sprain a joint. Besides that, the most common complaint that is that's referred from the family physician or your common doctors are usually back pain, knee pain, ankle pain, and shoulder pain. Yeah, this is the sequence. Most common by far being low back pain. So a lot of my patients and I feel a lot of the public like to know about what they can do to deal with this pain before coming and seeing a doctor. Although seeing a doctor is a good step in dealing with pain, but a lot of patients like nowadays have access to a lot of information out there. And today I thought it'd be a nice session for us to share with people who have experience in dealing with this kind of situations. And I have the clinical practice experience, and I thought it'd be I'll have a good colleague of mine, Miss Daphne, and Miss Daphne will be going about a little bit more in depth about different types of pain medications, and what can be what's available out there that you can go buy. I'm not suggesting you go buy by yourself, and most of these medications are almost almost all of the medications that has been prescribed before needs a prescription, but they are also available over the counter. What they call over the counter means that you are able to buy you can buy anywhere or your local pharmacy without the need to see a doctor or a pharmacist. So basically, these are the medications that is allowed by the government, allowed by the FDA, the Food Drug Administration of the US, and these are medications that we are going to go through. So sometimes the patients get confused, and they don't know what is available, what can they do. And I think this will be a nice platform for us to discuss about it. So as again, when you have small pains or niggling pains, you often go to your pharmacist and you often buy medication. So today I think we'll get Miss Daphne Chen, and she's experienced in dealing with the matters on the other side, on the pharmaceutical side, and I hope that she'll be able to clear it up a little bit. So Miss Chen, what is actually the options that a patient has that doesn't need a prescription, that before going and seeing a doctor, they will probably come to you? A common example would be like, as all of us have a patient who has sprained his ankle, let's say, and is mildly swollen, he's able to walk on it, right? And he comes to the pharmacy. So what would be the options that is available, and where can you buy it, and which kind of places can you buy it?
Pharmacological therapy or non-pharmacological therapy. So for pharmacological,
So I guess we're getting, I guess the line is not very stable over on that side, Miss Daphne. We'll probably wait for you. So anyway, when dealing with pain, there's usually a common approach would be dealing with pain by assessing yourself. how much of pain do you think you are having? If you're unable to ambulate or do whatever that you were doing before, now let's say you're walking or you're playing tennis and you sprain your ankle, and you twisted or you rolled onto your ankle and you're unable to walk or walk after the incident, I think a good way, a good option would be doing cryotherapy. That would include icing. Oh yeah, that we have.
Sorry for the
Yeah,
disruption.
not a problem at all. So, Ms. Daphne, I was just telling them, like, what would be the first aid, or what would be the options when dealing with acute pain? So, acute pain, we usually deal by first we rest the joint, meaning that the joint above and the joint below, we rest it. So, let's say if you have a sprain of your ankle, I would suggest you to not mobilize, right? To use crutches to stop whatever you were doing before, right? If you're playing sports or anything, do not weight bear, right? And then we would use some form of icing, or what they will call ice therapy, which Ms. Daphne will talk about more a little bit. And also you have rest and you have elevation, and we have different methods of ways of dealing with it, and also oral medications that we will go through. So yeah, as you were saying, Daphne, the options that we have, and where exactly can the patient buy these modes of treatment, as what you said.
Okay, there will be two options. One is pharmacological therapy, which involve medications. The second one is non-pharmacological therapy, which involve the RICE method, which is rest, ice, compression, and elevation, which I will elaborate later. So for medications, the most widely available pain relief over-the-counter medications will be paracetamol, as I think most of you already know. So for paracetamol, there will be a lot of brand out there. So the branded one will be Panadol, the most famous one. Then there are also other brands which contain the same active ingredient, which is paracetamol. Same goes to acetaminophen, which is the same thing. So the other brands such as Euphamol, Paracap, they also contain paracetamol. So paracetamol itself comes with...
The doses are around the same, Daphne? The doses is around the same, or what doses would they be encouraged to take?
The most commonly available strength is 1 tablet for 500 mg. So the recommended for adult dose will be either they take 500 mg or 1 gram, which is 1 to 2 tablets every 4 to 6 hours per day. So not to exceed 4 grams per day, which is a maximum of 8 tablets. There are actually different formulations available out there. There is suspension, the syrup option, especially for children formulation. There are also combination formulation.
So when dealing with children, I guess you cannot give tablets, and they would be using syrup. So is it available? Where Daphne can you get this? Where can the patients get it from?
They can purchase it from the pharmacy, retail pharmacies. It is widely available. Then as for, sorry.
Yeah. What about places, big hypermart places like Tesco and Eon Big and all of them? Would you be able to get those medications over there?
Yes, you can actually even see it in 7-Eleven. You can actually see that they are selling paracetamol, Panadol, because it is an over-the-counter medications. But actually, I would advise all of you to get it from the pharmacy, so that you can at least get a consultation from the pharmacist itself.
Okay, let's take a common example like ankle sprain, as what we said just now, right? So it would include, taking tablets, as what you said, paracetamol. Is there any other medication that can be bought over the counter to deal with the swelling, and also the other methods? And what would be the options? Yeah.
You mean medications, is it?
Yeah, medications and other methods, but medications,
Okay, as for medications, they can actually opt for NSAID, which is another group of pain relief medications. And paracetamol is actually for milder pain. So if you're experiencing a more serious pain, you can even go for NSAID. However, most of the NSAIDs actually require prescription, but you can actually get it from the pharmacist.
So NSAIDs being non-steroidal anti-inflammatory agents, that will need a prescription. Besides that, anything for swelling, ointments, sprays, and all
Yes.
those methods?
There is topical formulations, medications, which such as like counter pain, the most commonly used counter pain. It contains methyl salicylate, and then they can also go for Voltaren gel or even diclofenac gel. These are also the commonly available topical gel relief medications.
What about this medications that's available with spray method? Because patients prefer spray. It's a nice method of dealing with it, and it's usually cold, as they usually say. So, do you know of any of them? And what would be the dose that you would consider? And what would you recommend these patients not do it?
Okay, for spray, the most commonly brand that you can see out there is Perstindo. It comes with the yellow bottle, and another one is blue color bottle. So for the yellow bottle one, it actually gives you a heaty sensation. However, for the blue color bottle, it gives you the cooling sensation. So it depends on what kind of sensation you want for the pain relief. Then the price range in the pharmacy is around 18 to 25 ringgit per bottle.
That's great. Yeah. What about ice therapy? Can you explain to the people about ice therapy and how you deal with swelling? Yeah.
Yeah, sure. Ice therapy, it is also known as cryotherapy. So usually they just apply something that is contain ice, such as ice pack or coolant spray that I mentioned just now, or even ice massage, ice bath, depending on the availability at that time. So it is by the mean of treating it with the ice pack. So these are basically the simplest way, time-tested remedies for managing pain and to reduce swelling as well.
So what do you suggest for ice pack? Is that is it easily available, and what are the sizes, and what are the joints that you usually put it on, or which would you prefer? Because if a patient would just go to a pharmacist, they would like to ask the pharmacist, like, if I have my knee, what kind of this ice packing would I need, or would I need a smaller one, or do I use a warm pack first or cold pack? They usually ask that kind of questions. So
Okay,
what would you
actually,
recommend?
there are different sizes of ice pack available in the pharmacies or even on retail online store of the pharmacy store. You can easily get it. The price range, depending on the size, it is about 20 ringgit, like that. Yeah. So
Yeah.
it can actually lower the skin temperature and then reduce the nerve activity by that way to reduce swelling.
Nice. And how long would you be the maximum that you would encourage a person to use it for?
We usually advise to apply it for 10 to 20 minutes each time. So be sure to wrap the ice object, the cold object, with a thin towel so that it doesn't, to protect your skin from the direct cold contact.
That's really. So everyone, we heard it from Miss Daphne. So you put ice immediately after the injury. So injury that would happen, the golden time is within 30 minutes. The faster, the better. So by putting ice, we prevent swelling, and we encourage healing. Yeah. So the different ice pack available depending on the joint that is involved. And also you can use it for muscle injuries or muscle tears, and icing does help reduce swelling and overall pain and stiffness. Yeah, as what Miss Daphne said. What about bracing, or or bandage is what they would say, and also different options of bracing, especially when dealing with the lower limb or the upper limb. Yeah. They're dealing with splints, and also bandage. When do they use it? Do they do bandage on everyone, or what do you suggest?
So for bracing, it is actually a compression therapy. There are actually different type of bracing, like elastic, bandage, or even those with support. So it depends on the type of injury. So if the injury types requires support, then you might need to go for those bracing with the support type. It may cost a higher price, which around 50 to 100 ringgit. However, if you opt for the easier option, which is the elastic bandage, it is around the price of 20 ringgit. Yeah.
Yeah.
So we advise to wrap the injured part or the sore area with an elastic bandage, because when they apply pressure on the painful area, it can squeeze the veins, so to reduce swelling in that way.
Yeah. So as we all know, when the injury happens, there's fluid that comes out from the blood vessel. That's the inflammatory matters, and this cause swelling. And by preventing it, we brace it, and we also elevate it, and we give it rest, and we intermittently bandage it. That means we would ice it first as soon as within the first 30 minutes, as much as usually 10 to 15 minutes. And after that, we will bandage it, and we won't bandage it too tight too. And as what Miss Daphne said, there's different types of bandage. There's elastic, and there's little cotton type. And you would prefer a bandage, an elastic bandage, or some form of protection like brace. Brace would include the knee brace, and also ankle brace, and also wrist and elbow brace. You have braces of all sizes, and usually you should be able to get it from the pharmacy or rehabilitation center. Usually over the counter, it does not need a prescription for a brace or a bandage. So as what Ms. Daphne said, there's a lot of options. Usually if you have a small fall, or you have a mild swelling of an injury, or you have a muscle ache that is terrible, or you cannot walk, so we would suggest you to look at these options. The options of medications, as what Ms. Daphne said, was paracetamol, acetaminophen, aspirin, and some muscle relaxant. And if it gets worse, then you look at the option of seeing your medical personnel, a trusted medical doctor or someone in the healthcare system, to see if the pain is worse, and you would need the use of a prescription to get non-steroidal anti-inflammatory agents. You also have tablets to deal with swelling, Pepes being the most common tablet to deal with swelling. You also can deal with it with using ice packing, as what Ms. Daphne said, and also you can elevate the limb, and you can use bracing. You rest the limb, and that would be the way to go. And icing for 10 to 15 minutes, 3 to 4 times a day, as soon as possible, and this would help dealing with the overall recovery and a faster recovery for yourself. So, Ms. Daphne, what would be your advice for safe medications? What would you consider, or would you tell your patients to be safe medications? Because over the counter, as you know, there's numerous kind of medicines out there, and most of them, I don't know whether they have certifications or anything like that. So I would like to ask you, what's the advices you usually give your patients, or the patients that come up to you, because they come up to you with the idea of getting better and they don't know very much. So what would be your advice for them?
My advice is patients have to let the medical personnel or the pharmacist know what is their condition, and if they're having any underlying disease, comorbidities, because that may affect the options of medication that we choose later, as well as the allergy. If they're having any allergy towards medications, they must review to the pharmacist itself. And also, if they want to check the registration of the medicine or any pharmaceutical products, they can go to the website, which is Quest 3 Plus. Just Google Quest 3 Plus product search. Then they will come to a page of under NPRA for them to search for the to check if the product or the medications is registered in Malaysia.
Yeah, that'd be a nice guide. Yes, thank you for that. And what was the website again?
Quest 3 Plus, QUEST 3 Plus.
Yeah. So, Ms. Daphne, would you like to take us for a take-home message before we end, or we can take any questions? If anyone has any questions, y'all, for Daphne or for me, y'all can put it down here, and we'll try to answer them. Please do remember that all the information we're giving is for patient information. It does not substitute you from going to see a pharmacist or a medical personnel, a medical doctor of your trusting, dealing with when you have an injury. Our advice is, these are informations that we would like to help you be more informed about the options you have, And if you think that the injury is bad or it's severe, we would suggest you to seek medical attention at your center nearest to you or of your preference. Yeah. So Ms. Daphne, the take-home message. Yeah.
Take-home message is to practice RICE that we mentioned just now: rest, ice therapy, cryotherapy, compression or elevation when you have injury, and also practice safe medications taking. Be sure to consult your medical personnel or the pharmacist before taking any medications. And also, if the pain is unbearable, be sure to seek for medical advice immediately, like what Dr. Sanjiv mentioned.
Yeah. So thank you so much, Ms. Daphne. Thank you for joining us today. And thank you everyone for joining us. If you have any questions, you always can put it up here, or you can refer to the website www.rampalsurgery.com, and we'll like to help you make a better and more informed decision about your healthcare. We would like to advise you to be cautious when dealing with medications, especially medications that does not need prescription, as what Ms. Daphne said. Make sure that it's approved by your local authorities. And we'd like to see you back again. We'll be having another Instagram session next week. But before that, during this week on Saturday, I'll be going live on Facebook Live with Dr. Sandra Maran, and she's based in Clinic Masuri in Langkawi, and we'll be talking about how to deal with low back pain in the normal clinic. Yeah, so please do join us on her Facebook. It's called Clinic Masuri 24 Hours Langkawi, and we'll be talking about low back pain and how we deal with pain. I'd like to thank you so much, Ms. Daphne, for joining us, and hopefully you can come back to us in Instagram maybe later in the year. Yeah, thank you so much.
Thank you for the invitation.
Bye-bye.
Bye-bye.
Thanks everyone for the invitation, for joining us. Thank you so much. Bye-bye.